Okay, so we're back now, and we're going to show you and tell you about her 3 daily medicines. She's got 3 medicines per day. Only one of the medicines is twice a day. The other 2 medicines, no, I'm sorry, 2 of the 3 medicines are twice a day, and one of the 3 medicines is once a day. So the 3 medicines we're going to have are this is Clavamox. This is her antibiotic. And as we see with the ice pack here, the Clavamox is supposed to stay in the refrigerator. So I'm going to recommend you do Clavamox with food because it could upset the bowel if it's on an empty belly. Plus, with that refrigerated aspect, we want her to get some nice warm food right behind that because otherwise that's pretty cold, for her throat. It's not a bad thing, it's just probably we want something warm right behind it. Okay? But Clavamox is our antibiotic, it'll stay in the refrigerator. Her second medicine is her pain drug, and that's Buprenex. So these 2 medicines are twice a day. And once we finish with the Buprenex, we're done. Once we finish with the antibiotic, we're done. So those medicines will not be refilled. Now, the third of her 3 medicines is a drug called Cerenia. And Cerenia, on the other hand, she's going to be on it at least a month and maybe longer than that, depending upon what we decide along the way and what our diagnosis brings us. But I want to show you 2 of the 3 medicines can go through the tube, but the third of the 3 needs to be done differently, and that's her pain drug. You may have noticed that her pain drug was in a syringe like this. It's not an injection, and there is no needle on the syringe. With the pain drug, what I want you to do is just get this up under her lip. I prefer top lip. Just get it up under her lip. You can leave the mouth closed. I'm making no attempt to open her mouth, nor do you have to get it on the side of her lesion. You could do the left side, but get it up under the lip at small volume, and you just push it in there. You'll probably notice a little swallow like that. That's fine, but it's super small volume. In fact, I think her dose is not even a 0.1. She's like 0.08. Okay? And we're doing that twice a day. So that's her pain medicine. Second thing I'll show you is her antibiotic. And that's the one that's going to be cold out of the refrigerator. So we'll want to, for sure, pair the antibiotic with a feeding. So I just showed you the feeding demo. Where I would put in the medicine is I would do the food first, medicine second, and always water last. To show you how we'll do that, just like with the food, except for it's going to be a much smaller syringe, much smaller volume. I have 1 whole cc of water here, but with her antibiotic, she's only getting 0.5. So we're going to push a half see-through there. I'm going to recap her tube at this point, put it back down in its strap. But if I were actually administering the antibiotic, because she's done with antibiotic for today, this is just water, I would actually do the water flush after the antibiotic. So that's the demo on 2 of her 3 meds. The Buprenex goes cheek and gum, not through the tube, and that's twice a day. Antibiotic goes through the tube. That's also twice a day. Now the third and final medicine is her anti-nausea drug called Cerenia. You're going to have to pick that up at the outside pharmacy. And she's had enough of that for today. So what we're going to try to do with the Cerenia is very similar to the antibiotic, except for plus or minus at the same time of feeding. Not a bad thing to do it at the same time of feeding, but it's not a must. And that's only going to be 0.3. So that's going to be way out here. Small volume again. And with the 0.3, push it through. Now, if you do it independent of a feeding, you're going to have to do at least a water flush in order to push it through the tube. So those are the 3 medicines. We have Clavamox antibiotic, 0.5 cc's twice a day. Buprenex pain drug, I believe she's 0.08 twice a day. That is correct. And then the third drug is the Cerenia. That comes from the outside pharmacy, and that's 0.3 cc's once a day. So Anna will also provide you with my cell phone number. My cell phone's not doing video as well, so she had to let me borrow her cell phone video. But she'll send you with my cell phone also, and direct all your inquiries to my cell phone, please. All right, we'll miss you, kiddo. You be good out there. And y'all call me and text me with any concerns over the weekend. Thank you.